Hello, everyone, and welcome to our live show here at the National Optometric Foundation. And I'm so excited to be here. My name is Dr. Timothy Brown, Treasurer for the National Optometric Foundation. And I'm excited to bring another phenomenal show to you. I'm going to have an awesome guest on the show today that I'll introduce to you later there. But thank you all for tuning in. Thank you for sharing this with your family and friends, inviting them onto the show so that they can learn as well there too. The National Optometric would like to help preserve vision. So we continue to educate the community, do these live shows so that communities are educated about their eyes, about their rights as patients, and also so that you can also ask questions there. So tonight, if you have a question for myself or for our guest speaker, feel free to type it in the comment section below, and we'll be glad to take some questions tonight as well there too. Just a little bit about our foundation. The National Optometric Foundation is the financial arm for the National Optometric Association. And we support the NOA in various ways as being a support arm with students who are currently in optometry school. We are supporting them in ways where students who are thinking about going to optometry school, maybe they're taking certain exams and there are fees for that, or they want to travel to the NOA conference. We're there to try to support them, help them get there. We're also supporting communities as we go to the National Optometric Association convention. We're helping with eye exams to the community. They get eyeglasses there. Some get their glasses the same day. We're also educating communities and churches and schools and educating our patients about their eyes, about their health, about the three silent killers of vision: glaucoma, hypertensive retinopathy, and diabetic retinopathy. We also support in ways of providing scholarships, and we want to thank our generous donors for giving us those funds that will allow us to continue to be a resource for so many others that are in need out there. So if you would like to contribute to us, there's going to be various ways that I'll share throughout the show with you where you can contribute and you can follow our foundation there to continue to stay on top of what we're doing every month. You can go to our website, the nationaloptometricfoundation.com. You can also follow us on Facebook. We have a Facebook page here as well, National Optometric Foundation. We also have a YouTube channel, and we'd be glad for you to go ahead and follow us as well on our YouTube channel. And then also, if you would like to contribute, we have a Cash App as well, and that is the $ Protecting the Vision. So if you guys I hope that you enjoyed the show. I hope that you will go on our YouTube channel and see some of the shows that we've done in the past. And if you would love to be a part of the National Optometric Foundation, we would love to have you as part of our foundation as well. They're supporting us and giving us some great ideas where we can continue to support the community and support students who are thinking about becoming future optometrists as well. So tonight, guys, I have one of my great friends, my colleague. We both went to the Pennsylvania College of Optometry. We were class officers when we were in school. I was a class president, and she was the most supportive vice president that I could ever ask for. And I'm going to introduce her to you tonight, and we're going to bring her onto the show because I think she has so much to offer to our listening audience tonight. And you guys go ahead and get you some paper, get you a pen, and jot down some notes so that you will be educated about the things that she's going to talk about tonight. Dr. Essence Johnson is an HBCU made, residency trained community and correctional health optometrist in Dallas, Texas. Dr. Johnson received her Bachelor of Science in Biology from Prairie View A&M University, followed by her Bachelor of Science in Vision Science and Doctor of Optometry from the Pennsylvania College of Optometry at Salus University. She is a fellow in the American Academy of Optometry and a diplomat in the American Board of Optometry. She is also a diversity, equity, and inclusion champion, receiving certificates from Cornell University and the University of South Florida Monmouth College in Business. Dr. Johnson was the 2021 recipient of the National Optometrics Dr. Edwin C. Marshall Emerging Leader Award. She was also recognized as Vision Monday's 2021 Most Influential Women in Optical honoree in the Rising Star category. She was a 2021 Women in Optometry Thea Award nominee and awarded the Thea Award in 2022 in the mentoring category. Dr. Johnson is a 2022 recipient of the President's Medal at her alma mater, the great Pennsylvania College of Optometry at Salus University. Dr. Johnson is a life member of Sigma Gamma Rho Sorority Incorporated and a regional trustee for the National Optometric Association. She serves on the Transitions Optical Diversity Advisory Board, is a consultant for Johnson & Johnson Vision Care Incorporated, and has been featured in video and print on various outlets, including Defocus Media, Review of Optometry, Contact Lens Spectrum, Eye Care Business Magazine, and as a guest on a segment on a segment as well there. So let me go ahead and tell you a little bit more here about Dr. Johnson. She was on a segment called Fit, Live, Win on Roland Martin Unfiltered. Dr. Johnson is also the Chief Visionary Officer of Black Eye Care Perspective and co-founder and co-advisor to the Black Eye Care Perspective Pre-Optometry Club, where they are defining the color of eye care industry 1% at a time by creating a pipeline for Black students into optometry and cultivating and fostering lifelong relationship between Black eye care professionals, the industry, and their communities. Help me, ladies and gentlemen, help me to welcome Dr. Essence Johnson. We're so glad to have you on the show. Thank you so much for being our guest speaker with us tonight. It's so good to connect with you again.
Hello, hello, hello. I am super, super excited to be here today on behalf of the NOA and the NOF, and of course, on behalf of one of my great friends. Tim probably undersold us, but we were the Bonnie and Clyde, the president to vice president, the peanut butter and jelly, while we were in optometry school all 4 years. And it has been a pleasure to serve and to see how we serve now that we are official doctors of optometry.
Yes, yes. And it was such a pleasure. I'm telling you, I was able to do so much in optometry school because I had your support. I had you there beside me. If I needed more fire in the room, all I had to do was bring you in and it was done. So thank you for all the things that you did to help support our class and for supporting me while we were going through optometry school there. So many communities had an impact upon them because we got out there, we did vision screenings for them, whether it was just for children, whether we go to the church and did vision screenings for them there. We were right there. We go to colleges and did vision screenings. Thank you so much. And we had a lot of bake sales too for our class.
We love the cookies and we love mentoring and we love doing the screenings in the community. I think that perfectly sums up our 4 years at PCO.
Absolutely. And thank you for coming in. And before we get into the show, I just want to say, everyone, we are honored to also take a moment to recognize all of those who have been survivors. This is Breast Cancer Awareness Month here in the month of October. And we give cheers and support to our survivors of breast cancer, to those who are still fighting, and some to those who are angels now because of breast cancer there. So continue to support our survivors of breast cancer and love on them as much as you can there. I'll be in a breast cancer walk next Sunday, as a matter of fact. They're coming up too. So just wanted to mention that in this segment before we started talking today. The topic for tonight is disparities in healthcare, how to show up better for our patients, and also how to help patients be better advocates for themselves there. So that's the main frame for tonight. But I know that you're going to have so many other little small things that's leading up to that main topic there. So let's just start talking about in general optometry. You know, optometrists, ophthalmologists, you know, people sometimes get those confused. And so I just want to hear you talk a little bit about the difference between the two.
Yeah, so I wanted us to bring these topics in front of our community, also in front of our colleagues, and just in front of everyone to know how eye care is healthcare and how we all kind of interact and interrelate. And the first part of that is knowing the difference between your different types of eye care providers. So people like myself, Dr. Brown, I see Dr. Whitehead, Dr. Cleaver, Dr. Boone in the audience there. We are doctors of optometry. And in many cases, I know we said it on some previous shows that we are the primary care providers. But when we're talking about primary care, a lot can happen during an eye exam, during just this routine eye exam. We see people for just everyday routine care. So that means that whether you think you can see, and you see, I said think, because there's many people who are like, my vision is good, but vision is two parts. It's the part that we're seeing with our physical eyes and whether or not we need glasses, contacts, or other interventions to see better, but it's also the health of our eyes. And the only way for us to truly know the health of our eyes is through looking at it, being able to dilate your eyes, being able to do certain imaging or taking those photos that offices may provide. Then from there, some ophthalmologists do primary care, but a lot of times they're the specialty to the specialist to our specialty. Being an eye doctor is already a specialty in and of itself, but we have that extra layer of specialists that are doing the treatment, the management of the diseases to a higher extent. Normally it's to a surgical extent. While in some areas, in some states, we can do minor surgical procedures, a lot of times if you need laser injections, if you need your cataracts removed, if you want laser vision correction, those types of things are done by being referred to an ophthalmologist. So the whole healthcare system is a continuum. It's intercollaboration between different specialties and subspecialties and specialists. And we all work together to make sure that you're seeing well, but you're also living well, and that you're doing well overall. So I definitely encourage everyone to think of their eye care provider as just another part of their healthcare team, and not that we are working isolated or individually. We are a part of the whole body system. And there are a lot of things. Tim mentioned today, Dr. Brown, about breast cancer. I want to say one of my favorite, for the lack of better terms, cases is how on 2 occasions now in my 12-year career, I have been able to diagnose breast cancer returning in someone's body, all because of an eye exam, all because some of the first signs of the condition showing that it's returning and that it's metastasizing to other areas was because they were having blurred vision. And things like breast cancer and lung cancer are more likely out of a lot of the cancers to return. And if they return to the eye. And I feel like, especially in those individuals who have had a mastectomy or things of that nature, the eye is the next place that the breast cancer tends to return to.
A lot of people do not realize that their optometrists, we're the gatekeepers to the healthcare system. There's a lot of things that your optometrist will discover about you that maybe your primary care doctor has yet to discover. And then we communicate to your primary care doctor, we say PCP, so that they can further investigate and do any testing and further management, treatment of what we are sending you over to them, for. So you share some great information, and then just knowing that, yes, optometrist works along with optician, works along with ophthalmologist as well there too. We're all working together, that open communication. And that's going to be something that you'll probably hear later on in this show about keeping an open dialogue with your doctors. Doctors, hey, buddy, doctors have to have that open dialogue with each other. And then we also want that open dialogue to be there with the doctor and the patient as well there too. So there should not be a time where you are fearful of having a conversation with your optometrist, with your physician, with your ophthalmologist there. We are here to better serve you, to take care of you. So we want you to make sure that you are bringing questions. If you are having second thoughts about something, we want you to feel comfortable talking with us about that. So some of you who may be listening tonight, put in the comment section there. Do you have good dialogue with your doctor, your optometrist, your physician there? Put down in the comment section there if you have an open, comfortable conversation with your doctors when you go see them on a yearly basis. And just knowing, guys, not to delay getting your health checked. Go see your doctors. Don't delay. I always say, don't delay, do it today. We are here working as a team, helping to save eyeballs, one eyeball at a time there. So we want to see your face in the office. We want to see your children in the office. We want to see your grandparents if they are around, your neighbors, optometrists. Welcome your family into the practice there. And it is there that you will learn so much more about your body. It's not just the eyes that you will learn about. You'll learn about your overall health as well there too. So please make sure that you schedule your annual eye exam with your doctor. This is why the National Optometric Foundation will continue to do these monthly educational podcast live shows here, because we want to educate the community so that you will be aware of the rights that you have, and knowing about eye care and knowing about your health as well there too. So very good, Dr. Johnson. And I'll turn the show back over to you, because I know that there are other things that, when we go to school, we can go to school and start a practice, and you can have different modes of practice. Some people, sometimes they decide to stay a little longer and do a residency. You yourself, I think, made that option there too, and that's a great thing. It gives you more studies, more education, and opportunities there to expand who you are, so that you can be a better optometrist for your patients out there. Do you want to speak about that for a little bit?
Yeah. So when we're talking about where do I go and get my eyes checked? So we talked about the difference between optometry and ophthalmology, but the next piece we want to talk about is modes of practice. I want everyone to know that all doctors of optometry, we've received the same type of education. There's about 23 optometry schools. Most of us has went to one of those 23 that are here. There's 2 in Canada as well. But no matter where you went to school, by the time you graduate, we are all equipped to seeing patients. So some of us go into private practice. Some of us are going into those corporate practices. So you may see them at the Walmart or at the Target, those types of places. Some of us are going into hospitals or different community clinics. Some of us are in academia and working even at the clinics at our schools. Some people are even like myself and some other doctors, and we're even going to the jail. So there are many different modes of practices that you'll be able to get your eyes checked and see an eye care provider. Then within that, we have some of us who have done residency, which means that we did an additional year of training in a certain specialty, but there's many of us that still choose a specialty and choose to acquire those additional skills just through day-to-day experience. And there's really no right or wrong way, but I think over time, people tend to find their specialty or their niche, whether it's through classical training in a residency program or just in the demographics that you serve or the interests that you may have. So what are some types of specialties that you may see? We mentioned earlier that everyone should be getting their eyes examined, from the youngest of the youngest patients to the oldest of the oldest patients and everyone in between. Everybody. I hear a lot of questions that are like, when should I take my eyes or take my kids to get their eyes examined? And last month when we had Dr. Morrison, she's like, at her practice, she sees kids as young as 3. In my practice, I see kids as young as 7, but we have other colleagues who will see children out of the womb. So really, if you have eyes, it's never too early or too late to get them examined. And then we have different specialties, not only in the age of our patients, so from pediatrics, the younger kids, to geriatrics, our older individuals. We also can specialize in contact lenses. There are our more common traditional fits, just helping people see up close or far away. But sometimes people have abnormalities on the front of their eye that makes it difficult to see by using glasses alone. And we have a whole area of colleagues that love to fit specialty contact lenses. So this is from people who may have the front surface of your eye, your cornea, damage or irregularities, to people who may even have lost an eye and need more of cosmetic or prosthetic type of lenses as well. We have specialties in ocular disease. That's where I did my residency, where we're looking at diseases of the eye. And these diseases can happen on the front surface of the eye all the way to the inside or the back of the eye. That is known as the retina. And we also have low vision specialists. So these are doctors that see patients that may have a congenital disorder, which means they were born with it, or an acquired disorder means maybe it is a disease process that tends to progress over time or that you get later on in life. Maybe it's due to some sort of trauma or accident, and your vision is unable to be correctable to 20/20 or driving level vision, or vision that may prevent you from doing your daily activities, and you need special care, therapy, and devices. So a lot of times in the low vision department, they're using special lenses and special telescopes to help people see as far as they can with the amount and the field of vision that they may have. Also help them regain some of their control from their day-to-day activities and life. And then we also have just everything else in between. We have some people that are specializing in one particular condition. We have a lot of our colleagues that are starting these different dry eye spas and oasis, where it's kind of a full facet of all things and new technologies when it comes to dry eyes, but they're also a lot of times combining that with other type of wellness type things. So there are all types of practices that are out there. If one is not able to address your particular need, then there's always someone else to refer to. There are some practices that are able to encompass the whole entire family. There are some, like in my case, I take my kids specifically to a pediatric optometrist, and then we have a family optometrist, which is not much different than what people even do in dentistry, where there's a dentist that is just for braces or just for children or for the whole family. We have those same type of options in optometry, ophthalmology, and in eye care in general.
To the teamwork, we are all working as a team to help different populations of people with different challenges that they maybe have when it comes to their vision and their eye health there. So whether or not if a colleague is specializing in contact lens, ocular disease, or in the PEDS department there, or glaucoma, or low vision, we're all working as a team, and sometimes that may not be your specialty, and we'll refer the patient out to someone else who that's their focus, that's their main focus. I was at a practice where the main focus there was a lot of ocular diseases there, and glaucoma, macular degeneration there, and we did some fitting of contact lenses there on patients there as well. But where we are now at Insight Family Eye Care, with my wife, Dr. Brown, the specialty is pediatrics. So we see children age 6 months on up. So you know what other optometrists who don't? They send them to us. They send them. Here you go. Here's another patient to take care of. It happened again today, where a colleague around the corner referred a patient over to us. And that's what we do. We work together. We communicate with each other, all because we want to be there for the people. We want to be there for patients in general there. So I'm glad that you broke that down for our listening audience there, because many times people don't know. They might think they go to an optometrist and they do everything, and an optometrist may not get a day off if they did every single specialty, So we have a general knowledge of everything, but that may not be the main thing that we want to focus on while we're in practice throughout the week there. So I will say I'm glad that, different specialties exist. Even if you think about the pediatric there, You would think, where would these people go? Low vision. When I worked there at PCO in the low vision department, there's a lot of people in need, and it's rewarding. The other thing is, it's rewarding when a doctor is able to help patients that's challenged with vision problems there. It's rewarding knowing that we can have resources that we can refer them out for as well there, if they need a telescope, if they need a computer to magnify things for them as well there too. So those tools are out there for us to connect them with there as well. So I don't want to steal the show. I'm going to give you back the show there as we continue to, talk about disparities in the healthcare system. How can we be a better advocate for our patients, and how patients can be a better advocate for themselves there. So when we talk about disparities in healthcare, kind of break that down for our listening audience. What is that? What are we talking about there? I understand about being an advocate. I had to be an advocate for my mom when she was in the hospital for several months there. Someone speaking up, for someone else, their wishes and what they need there, because they may not have the knowledge, they may not be able, to do that. So help us out with that, talking about disparities in healthcare, if you would.
No, Dr. Brown brings up a great point. Both me and him, while we were in optometry school, we experienced the loss of a parent. And I think for both of us, that really has fueled the type of doctor that we are today, in knowing how not only to bring sight in a way to the sightless, but to bring a voice to the voiceless. So when we're talking about disparities in healthcare, and I want to focus in particular the disparities that exist with minority patients. And a lot of times this is disproportionately affecting people of color. And I want to share that one very interesting fact that kind of comes from the National Medical Association. They were talking about how pretty much just being a person of color, just being a racial or ethnic minority, even if you have the best insurance, even if you have the best job and income, even if you're the most knowledgeable person in the room, that just by being a person of color, you can be at risk for adverse health outcomes. And this is comparing people like myself to a white patient, that there are biases, there is discrimination, there are systemic things that have plagued, our society, and in particular the healthcare system, that is causing people of color to lose vision, to die, to not be provided the same level of care just because of the color of their skin. And so I wanted to talk and share about how can I, as a patient, be able to advocate for myself, but also how can myself and other people like me as doctors advocate for our patients. And a lot of it comes down to education and to communication. So what I have noticed, especially working in community health, it always surprises me when people come and say, like, one, this is their first eye exam out of all of the years of their life. And I see patients that some are young, but most of them are like 20, 30, 40, 50, 60, even 100 years old. And over the last 8 years, I still have about 90% of my patients that say, you were my first eye exam. This is us not even touching, I am probably the first Black doctor that they ever had, but I am just their first eye exam in life. And you would think, unlike in private practice over these last 8 years, sometimes I don't always see the same person twice, let alone three, four, five, or six, seven times. So I know that when they're in my chair, I make every moment count for them, just in case I may not be their next doctor, or if I may not see them the next year. And one thing that I've heard a lot in practice when I'm examining my patients is, not only is this their first eye exam, but a lot of times they tell me, you know what, Dr. Johnson, you are the first person that has ever told me about this. You mean you were born with some sort of congenital eye condition and you have been seen multiple times. And out of all of those times, no one has taken the time to explain the condition to you. And I will say a very interesting fact that a friend, Dr. Pepper, hey, Dr. Pepper, that she brought up was there was this study with, I believe, medical students, and they were discussing end of life scenarios with their patients. And what the study showed was that between their Black patients and their white patients, they weren't saying anything different per se, but what was different was subconsciously or unconsciously how they were communicating the information. So it was the nonverbal cues, what was their body language? How were they entering the room? How were they receiving the patient, and how was the patient perceiving them? How much time did they spend in that room? How much detail did they give that patient? And whether the patient asked for it or not, were they giving them all of the different best and worst case scenarios, giving them all of the treatment options, not recommending something or not recommending something because what they perceived their economic status or ability was? And I would say really wish that I could say this is very shocking, but like Dr. Brown, in my own personal family, I have seen this play out in other specialties. I have seen this with my great grandmother in her healthcare. I have seen this with my maternal grandmother, who passed away when I was in middle school, all because she had underdiagnosed and untreated diabetes. Then I saw it with my own mother with her cancer treatments, and where, because now I was in school, because I understood the healthcare system, I could show up and be a better advocate for her and say, hey, give us all the information. Let us, read it and digest it for ourselves. Or, hey, I have some questions about this treatment. Or maybe I heard about this. Can you explain to me why we would or we are not a very good candidate? And then I see the same things happening again to my own siblings, my own sisters who are only in their 30s, as they deal with things like fertility, or even my youngest sister, she had COVID, and how her outcomes could have been very different if we as her family weren't good advocates for her, but more importantly, if her care team didn't care about her. And I think that that's a very scary thing to think, that when you go to a doctor's office, eye care included, that there is a chance that your care team does not care about you. And there are times that sometimes we just do not know what we do not know. And I've had patients say to me, Dr. Johnson, whatever you recommend, I'm going to do. That is a lot of responsibility. But also I question, are they saying this to every doctor? Are they saying it to me because they identify with me, they trust me, they can see themselves in me, and they know that I'm seeing, my own family in them, so I have their best interests at play? So patients a lot of times are entrusting us with a lot of responsibility, with a lot of ability to be able to treat them, manage them, and diagnose them appropriately. Then, as we're thinking and talking about, okay, well, we want to get people into our chairs. So when we hear in our profession say, we don't need any more doctors, the reality is that's just a small percentage of just our patient base. When you are more in private practice, you have a luxury of kind of having a closed panel. Some patients you may see where the doctor's notes may say that they are or they're not accepting new patients. And a lot of that has to do with capacity. A lot of that you have to look at just your city and how many doctors are there per capita. And the reality is there are not enough doctors of any specialty, let alone there are not enough eye doctors to check the eyes of every single person who has a need. Last week we just had World Sight Day, and they gave some really good statistics. And these are worldwide statistics, but it's showing that 90% of vision loss can be prevented, and that the leading cause of vision loss worldwide is cataracts and uncorrected refractive error. So that means that 671 million people in this world, they have poor vision because they do not have a pair of glasses, or they lack the accessibility or the affordability or the awareness to even know that they need to correct their vision. And I will say, even when it comes to cataracts, that is the most referred procedure that I refer for in my mode of practice. In my mode of practice, that's predominantly Black and Hispanic patients who are getting their first eye exam in the third, fourth, sixth, seventh, eighth decade in life. They now need cataract surgery. And then when I have to tell them that it's a 6 month to a year wait, especially when insurance plays a role, their face just is in shock. They were like, can you get me in sooner? How come the ophthalmologist is not going to see me sooner? It's because literally everybody in this world is waiting in line to get cataract surgery. And when we have some barriers like insurance and finances, everyone is not accessible. Just to show you just the disparities that exist in something like cataract surgery. So I work in community health. If a person comes, more than likely their cataracts are bad enough to warrant surgery, or they're at the point where it matters to them. But because we have so many patients, I personally have to wait till it drops to a certain level before I can even refer them, or it's going to get denied in our system. Then, when I am telling them that it's a 6 month wait, and if you imagine someone who has already been dealing with such a decrease in vision for such a long period of time, then it is such a shock that say hello to everyone, because they can hear you and they can see you, and we're talking about the eyes.
Mama, can you help me?
Thank you.
Why would you make my helicopter with me?
I will after the show. And so when I have to tell them that,
Ow!
please, when I have to tell them that it's a 6 month wait or a year wait, then they're really taken aback and they're very uneasy that, oh wow, did I wait too long? Will it ever happen? But then to tell them that if you're able to go to an outside practice, or if you had a different type of insurance, you can essentially be seen within the next couple of weeks or within the month. It just shows that difference between what being insured and uninsured does, but also that power of being able to communicate with your patients, to be able to give them that information and insight of what is going on with their body. Using cataracts as a good example too, it's a good place of not just to refer the patient without giving them the appropriate information and history on what is happening, without sometimes even giving them the physical documentation that is going over what is a cataract, this is what the surgery may entail, these are the things to expect, even after treatment. So if you have maybe a patient base where there may be a language or a cultural barrier, or sometimes we see, where older patients may be coming, or even younger patients are coming, and they're not bringing that extra person that can be that extra set of ears or eyes. It helps to give them that printed information, so that when they go home, they're able to share that with their family. And then if they want to call back the office, they have something to refer and to defer back to. So those are just some of the disparities that just exist in having insurance versus no insurance, having certain conditions and knowing, what is the typical treatment plan and cadence, being able to set those expectations for your patients. A lot of, I would say, the distrust that patients of color experience, it's because they're fearing some of the unknown. So if we're able to articulate and communicate what the expectations have, and they don't just feel like they're getting lost in the sauce into a system of referrals, that is very helpful. Then to be mindful of that thing called tone. Are we looking at how we are communicating with our patients? Is it that, when, like in this case, when you have a child that's in an exam room that's crying and they want to put together their fire truck, but their mom wants to get the exam, are we hurrying through that piece of the exam just to please that at the sacrifice of giving them very valuable information? Are we doing the due diligence and maybe taking the time later of knowing, like, what, your child wants you, we're going to finish this part, but, I'll have someone from my staff or even myself follow up with you to be able to give you that additional information in a setting where you're able to do that. And I've done that in my practices. I've been on the phone, with daughter-in-laws and other kids and things like that, to ensure that my patients are understanding the information that they're receiving, or that we have technology to communicate with those family members so that they're able to make that informed decision. And I always want to make sure that my patients are leaving knowing that they had all their questions answered. And I leave them with that time where the door is open for them to ask more questions. Or a lot of us have those communication systems where the patients can text or message you through. We use a system called MyChart to ask those questions and being available to them. And even sometimes going that extra step, like if you're sending a patient to the specialist, or sometimes we send patients to the ER because there's different things that go on with their eye, taking that extra step of maybe sending them with the after visit summary or with a letter that is describing it, so that they're not just showing up to the specialist and they're like, yeah, the doctor said that there's something wrong with my eye. The doctor said that I can't see to see you. And that really helps not only foster that trust and confidence with our patients, but it also collaboration and communication with the other specialties, and help us understand one another, have an appreciation for one another. Because no one wants, those kind of empty referrals, or feel like you're punting off a problem to another specialty. It works when you're giving those nice, well-informed, soft handouts to the patient or to the provider. And then when we are with our patients, I do want to go back and talk about communicating. And the current NOA president, Dr. Larry Jones, he always says, imagine if that person was your mother, your father, if it was your child, if it was your spouse. And that really helps sometimes to ground us when we're just trying to get to the next patient, where you see that it's getting close to lunch and the problems are kind of surmounting. The reality is sometimes not every patient is a quick 10-minute eye exam. I think many of us, you may have been that patient. You may have been the doctor that has that patient that they're in and they're like, so doctor, I need to go pick up my kids. Everyone, when you have your appointments, I know time is short. I'm that mom too. I take my day off and everybody is getting eye exams and dental checks and things like that. But do yourself a favor and don't stack those appointments too close together. Sometimes things can be handled very quickly. Sometimes we're doing what we call in school, they make us do this 10-minute practical. So yeah, we have the ability to do an eye exam in 10 minutes, but there are some times where it's a little bit more than a 10-minute exam. Sometimes we see some things in there that even though you see perfectly fine, there's something going on back there. I would say a condition where that shows up a lot is diabetes. Diabetes, yes, is something that's affecting our small blood vessels, but do you want to know where else there are small blood vessels? It's in the back of the eye. And you can see perfectly fine with or without your glasses, and the inside of your eye can be leaking and bleeding. And depending on what stage and what severity that leaking and bleeding is, dictates what our next steps are. Some are come back in a year. Some are come back in 6 months. Some is come back in 3 months. Some is don't pass go, don't collect your $100, go straight to the ophthalmologist. We need some more testing. We need them to look into your eye more. You may be getting, laser or injections, and we need to take that time to help you understand that and to go over those options. The other part is making sure you go for an annual eye exam. A lot of people, when it comes to the eyes, they were like, if I can see fine, or some people are like, as long as they can see pretty, they don't need an eye exam. And that is not true. I think we've said it many times on this show before, that just like you would go and get your annual pap smear, mammogram, prostate check, your regular routine exam, your routine check for your teeth, you should treat your eyes the same way. More importantly, so because a lot of times if you're starting to see problems in your vision, it it is often a challenge for us to restore that vision. And when you have things on, we talked about those silent killers, the hypertension, the diabetes, the glaucoma, those conditions in particular are silent because it's something that you need to have a dilated, a comprehensive eye exam for us to know what is going on. I just can't look at you and know that you have glaucoma without physically looking inside of the eye and looking at your nerve. I can't just look at you unless sometimes, you know, you have other signs of diabetes that is showing that it's not under good control. But I cannot just look at you with certainty and know that there could be leaking or bleeding or swelling in the back of the eye. And a lot of times, what I tell my patients is once these things start, and once your vision declines, and once I'm starting to refer you to the ophthalmologist, then know that kind of the vision that we're starting with may be our best case scenario. A lot of times, once we're referring you, it is more for eye saving procedures, and not all the time is it for sight improving procedures. There's a lot of things that are being developed in that pharmacy pipeline when it comes to conditions like diabetes or macular degeneration. And the goals of those medications are to give you a few more lines of vision for just a few more years and kind of slow the progression. And a lot of times it is not going to halt or stop it. So definitely, like Dr. Brown was saying, you know, don't delay. See something today applies to the whole body. It especially applies to the eyes. I can't tell you how many patients that have came in and they're like, this has been going on for a day, a week, a month, a year, years. And at what point were you going to stop and say something? At what point were you going to come in? And a lot of times the response is, oh, I was waiting for it to get better. The eyes is not something that we tend to want to wait until it improves. It is actually very beneficial that at the moment that you're seeing some flashes, some floaters, the vision is getting a little bit dim. It is to your benefit to go and see your eye care provider so that we can see what's going on. And then from there, we can assess, like, yeah, you know, give it a couple of weeks, or, you know, things are going to improve over time, or, you know, get ahead of the condition. Definitely when it comes to the whole body, but eyes in particular, being proactive and preventative is better than being kind of reactive in treating it. Because again, if it's something that is more serious, like glaucoma, which affects the nerve in the back of your eye, where your eye pressure can be high, and sometimes just by looking and feeling on someone, we don't know that the eye pressure is high, that we don't know that the pressure has been high for a period of time, and you're slowly losing that peripheral vision where things are tunneling in. And sometimes there's people literally coming in looking through this little bit of vision that they're like, oh, doctor, I think something is wrong. When we have the skills, we have the eyes, we have the technology to catch a lot of these things before they have progressed. And the fortunate part about something like glaucoma, there are treatments that are more preventative in comparison to some of the other eye conditions, where we can get you in for surgery, or we can start taking, you know, drops or other medications to help slow that process down. But our first step is we have to get you in the chair. We have to build an environment where you feel included, where you feel that you're going to be taken care of, that you want to come in. Probably unlike some other specialties, the optometrist at the end of the day tends to be a little less scary. Yes, we have drops. Yes, we have lights. Yes, we have puffs of air. But I would like to say that we're one of the less scary specialties. And once people come, they want to come. They want to come because sometimes in comparison to other specialties too, we give a little bit more chair time. We give a little bit more TLC. We pride ourselves of taking our time to make sure that you understand not only just your eyes, but how things that happen to you systemically can affect your eyes, or how the eyes can tell us that something is going on with you systemically or throughout your body. The American Optometric Association, they published like a list a couple of years back where there's over like 200 conditions that can be traced back to just the eye. So we talked about cancer, we talked about diabetes, We talked about hypertension, cholesterol, but sickle cell anemia, different types of cancers, even like MS, things like that can help us with diagnosing the different things that are going on in your body. And there's been a lot of times that many of us have stories where people may have came in because their eyes were giving them a little bit of trouble, but it helped us diagnose something else. There are times where people came in and I saw some swelling, and then they go and get an MRI and they may have had a false tumor-like condition, or they may have actually had a real tumor that is going on. There are other times where people are coming in with eye troubles, and maybe they have inflammation of the eye. Maybe they are noticing that their eyes are getting red. A lot of times autoimmune conditions like arthritis, lupus, Sjogren's, sarcoid, they can cause inflammation in the body, and that inflammation can affect the eyes. So I encourage everyone that if you are noticing that you're having changes in your vision, go and see your eye care provider. If you are noticing that you just haven't had an eye exam, if you are that person and this is your first time, we like to be your first. Or if it's been your first time in a long time, we like for you to come back into our practices to make sure that you're getting your eyes checked, and so that we can go over just all of the parts of your health and be a part of your healthcare team.
Was like I was watching my favorite show. I was just like, wow, so much great information. I mean, the listening audience had to pull something from what you were saying. And there are so many ways that we can advocate for patients. But I believe one of the most important things that you mentioned was education, teaching the patient, breaking things down from medical terminology to layman's term, where they can understand what it is that you're talking about, and that they leave your office more knowledgeable about what they're dealing with, so that when they go to the next specialist who you refer them to, they have an understanding of what's going on. And I like what you said also there too. Most of the time we refer you to an ophthalmologist, it's for eye saving, not so much then sight improving, so we don't want it to get to that point. If it has gotten to that point, we still want to see you. We want to still detect and identify these conditions, and then get you out to where you can get better help and treatment there as well. So that's very good. And telling patients too, don't stack your appointments. Leave enough time in between where you may run over at one place and still can make the next one. And if you're bringing children, bring a snack. Children are not like adults. They can't keep holding out, and things of that sort. Bring a snack with you so that, they can kind of, stay in line, and they don't get out of place, and you don't have to leave the exam early before you're seen by the doctor as well there too, because we want to see you. Even if, like Dr. Robert, I knew I was going to do that tonight.
Okay.
I knew I was going to do it tonight. And I just said, I hope I don't do that. That's all I've known her as is optometry school, guys. I'm sorry. Dr. Johnson said, we love our first eye exams, we don't want that to happen now with children who are coming along. We want to see them early on. And there are optometrists who will see them, my wife included, will see children under the age of 7, under the age of 12. So you don't have to delay their eye exam like your eye exam may have been delayed there. But we don't talk bad about you if it's your first eye exam and you're 32 or you're 45 or maybe you're 63. Still come on in the door. We're here to help you. That's the beauty of optometry. That's the beauty of being an optometrist. We really do care about people. We're passionate about helping others there and making sure that you know what it is that we're doing when it comes to your eye and your health overall there as well. So good. You put out a lot of good points there, and I just wanted to follow back on some things there too. I think your patients talk to you and they open up to you when you build that relationship with them, Dr. Johnson. They trust you. And I think that's very important for that relationship to be established there between a doctor and a patient, that trust. So, and in the same way that patients, you trust a doctor to give you the best care, we trust that you're going to follow our instructions as well. So it works both ways, you know. So if we say take the medicine this way, please go home and do it that way and not your own way. And when you start feeling better, you stop taking the medication. If we say, hey, wait until I tell you to stop it, there's a reason for that, you know. So make sure that you're communicating with your doctor. Make sure that you are providing that same level of trust that you want to receive back from your doctor, as well as they are being an advocate for you. I think that when patients better understand what they're going through, patients better understand what their condition is, and you know, maybe what are some of the outcomes, they can be a better advocate for themselves as well there too. So that's why doctors go through this process of making sure that you understand. And if you don't understand or you don't get a good explanation, ask. That's one of the most important things that you can do at your appointments. Ask questions and receive answers there as well. So
And I think a good point to add to those things are not only ask questions, take notes.
take
There are
notes.
times that, even today, I sent a lot of information, and I love the patient that brings in that long goal, list of all their medications, especially when you're going to places in different modes of practices. Like in the hospital and a community health setting, I'm fortunate that I can see a majority of my patients' health records. But when you're
Right.
in private practice, that's not the case. I'm not
Nope.
going to know, what you're taking or what you're not taking. So write it down. If there is something that you want to know, write those questions down. If there's something else, a family member wants to know, write it down. And that's not just independent of the doctor, of an eye doctor. Any specialty that you're going to, take notes and write those questions down. If you forget those questions and say they pop up in the middle of the night, write it down and
Right.
send it to us so that we can have those conversations. You brought up the medication. I think something that we see a lot is, how are we administering things? So I will tell you, in an eye care practice, sometimes we give you oral medications, but a majority of the time we're giving you topical medications. Those medications are drops to be put into the eye or around the eye. I
Not in
think
your
it's,
mouth.
yeah, not in the mouth. And this is something where is either an urban legend or something. We go and ask the patient, how are you using those drops? And they're putting them in their mouth. So we are eye doctors. More than likely, we're prescribing you something that goes in the eye. The other part is knowing the duration of which you're taking stuff. Just like any antibiotics, a lot of times we're prescribing you antibiotics, anti-pain, anti-inflammatory, or kind of our glaucoma, viral, those other types of drops. So when it comes to some of those other ones, there is a certain period of time we want you to use it, a certain way to do it. But if you're doing treatment for, say, glaucoma, um, if just in case we don't tell you, maybe even something that you can ask is, am I getting refills for this? There are
Right.
some things we don't refill, and there's some things where we're giving you enough refills to make it for the whole year, whatever vacation, so that you cannot do without. And
Right.
there's a lot of times where we have patients that come back, and maybe it's just our miscommunication or misinformation or misperception, that they came to the contact lens follow-up appointment with no contact lenses, that they're coming to the glasses follow-up and they're having problems with their glasses, but no glasses. They like their old pair of glasses, but they sat on the glasses and it's not there. Or we're bringing you back for a follow-up and we put you on a course of drops, and then you're like, I stopped taking them, or I didn't know to refill it. So those are things too that kind of sometimes increase those disparities and those poor health outcomes, where we may have put you on something and wanted you to come back in a couple of weeks or a couple of months, and then you come back and you're not using it at all, or you weren't using it correctly. So again, that's where we can be better communicators with our patients, but also patients, for you to communicate better with us. If you're using the drop and it's been 5 days, 7 days, 10 days, and you're like, hey, pick up the phone. Normally, our staff is very well versed to be able to handle the questions. Not everything has to be a talk to the doctor specifically, or a
Right.
lot of us, again, we're using technology. So you can send us a message or an email and ask, am I supposed to continue taking it? But that's also providers why it's very important. Write stuff down for your patients, and walk them through. When I discharge a patient, a lot of times I don't let my staff do it because I want it to come from me. I want to highlight things. I want to circle things. I want to write things. Even if we're using pre-printed material, I go back, and even if the number is on there, I write it again really big to remind them that it's here. And also keep that in mind. Sometimes we're printing stuff and it has small font, and we just told this person they need cataract surgery.
Right.
So we need to make it bold, write it in a Sharpie, do a few other things too to ensure that our patients, remember and understand what they do. And just like what we do with our kids and just in our learning process, having them repeat back to you what you just told them
Bingo.
goes a long way. Having them be a part of their care. This is not a dictatorship. I will tell you, and I know we're getting close to time, but one thing that comes up a lot, I'll give another glaucoma example and kind of a cultural example. Sometimes, especially in the Black community, they don't want any treatment. Contrary to what you may hear, a lot of times they just want to fix it with the green rubbing alcohol and some ginger ale and some Vicks. So sometimes adding on all these other things, it's a lot. And I've had some patients where they've had glaucoma and maybe they're older or even cataracts, and they've told me, doctor, I don't want that. I do my best to educate, to give my best opinion, but there are also times where I have to respect a person's wishes, just like with any, health treatment plan. Our patients have the right to decline, but what I make sure is that they have all the information. And in some cases, some people may decline that day, but after I gave them written notes, after I've even proactively maybe followed up with them in a couple of weeks, or sometimes I let them know all their options, and I'm like, you know what, I'm going to just schedule you a follow-up, and we're going to just circle back in a couple months and see where you are. And there are times where they had a change of heart, and that is okay. You can always say no or defer something at the time and then change your mind later. But I make sure that I'm giving every patient every time the same amount of information,
Right.
regardless of the color of their skin. That I've had that come up a lot. How can I, as a non-Black doctor, Hispanic doctor, talk to my other patients of color the same way you talk to everyone?
Yeah.
Sometimes you may have to slow it
Can we
down.
go to the park?
I am going to take you after this. We may have to slow it down. We may have to tell it to them differently. But honestly, I don't use any other different words or language or cadence or speech because of my patient's color of the skin. But
Right.
what I do try to do is make sure that I am communicating effectively and affectionately to
Right.
my patient in a manner and in a language that they're able to understand.
Right. You don't have two separate guidelines that you follow for your Caucasian patients versus your African American patients. We treat them all the same. It's merged together. And that's how it should be. There should be uh, everything should be equal there when we're presenting it. People are people. We understand doctors need to speak to patients the same way that they would speak to their brother, their sister, their mother. Like you said, Dr. Jones reminded us, treat that patient as if that was your mother sitting in the chair there, with that TLC, that tender loving care. Follow the golden rule, do unto others as you would have them to do unto you. Those things will help guide you as doctors there in how you are communicating and building a relationship with patients there as well. So I really think those are great tips there to follow. And this is the beauty of why we do these shows, educating the community, educating patients, because many times they don't know. Many times the trust has been broken. There are reasons from past histories as to reasons why people may be skeptical of doing certain treatments and things of that sort and taking certain medicines there. And that goes back to the relationship that the doctor builds with the patient. Most of the time, patients can be skeptical, but they trust the doctor and the doctor can get them to follow that medication a lot better because of that relationship that's been established there. So, doctors that's listening, build that connection with your patients there. Be a better advocate for your patients. Explain things to them so that they have a better understanding and can then be a better advocate for themselves there as well. And I want to thank the national thinking national vision for giving us the opportunity to be able to do things in various communities. We've been doing grants to organizations in various states and communities, and they've been impacting lives, and people have been getting education, and they've been getting tools and resources out there because of the grant that National Vision has provided to the NOF there as well, and for being able to do shows like this as well there too. So we appreciate companies and sponsors and individuals for tagging along with the National Optometric Foundation and being supportive financially so that we can continue to do these things there. We can continue to listen to words of wisdom from people like Dr. Essex Johnson here on the show tonight there. We really do appreciate that. And thank you for giving your time and attention tonight to share your knowledge and giving us examples from real life situations there, right there in the practice there. So I know that no matter where you are, no matter where you go, Dr. Johnson, people are going to be blessed to be around you because that is what I saw during our time in Pennsylvania there at optometry school. So continue to do the great things that you're doing. I'm going to give you a chance to say any closing words that you would like to say. I also want to remind the listening audience that they can go back and look at other live shows that we've done on our YouTube channel. We have a YouTube channel you can go to and watch our shows from the past. Join us next month. We're going to shift over and talk about diabetes. It's National Diabetic Awareness Month there in November. So we're going to have another great speaker on. So we're going to continue to educate the communities there. And maybe there's something that we weren't able to touch tonight, Dr. Johnson, that we want to make sure that we get in. So I'm going to give you a chance to close us out with that, and then I'll come back and close the show again.
No, thank you, everyone. I think, as always, you can follow me at Dr. Essence Johnson. If you have any questions, please feel free to reach out.
Randall too.
And follow Randall Johnson as well. If you need an eye exam and you're looking for Black doctors, the NOA, even Black Eye Care Perspective, we have a lot of resources to connect you with a doctor of color and to be a resource. And like Dr. Brown said, we would love to see you. We would love to be your first and hopefully not your last when it comes to eye care. So definitely check out the National Optometric Association. Check out blackeyecareperspective.com, where we have a Black Eye Care doctor. Thank you. And we're all creating more awareness to put these types of information into the hands of the community, but also to increase and improve the health outcomes for our minority communities, and to put more doctors of color like ourselves in front of our patients and giving them that opportunity and that resource for them. So definitely go to our National Optometric Association web pages, to Black Eye Care Perspective, and check out our events that we have going on that is geared to increasing the awareness of just eye care amongst our healthcare professions, optometry amongst optometry professions, and our pipeline of Black doctors, starting from students or people as young as my son Randall over here, all the way up to us. We want to be a resource for you, and we hope that we see you.
Mommy, can I?
Or you're watching this live, make sure that you follow Dr. Essence Johnson there. She's doing great work. Make sure you don't forget to follow Randall as well. We want to make sure that we follow Randall. Hello, Randall. We love you, Randall. And there's going to be great information that we will continue to receive from Dr. Johnson. I know that she's going to continue within the community as well there. So you guys make sure that you follow Dr. Essence Johnson on her panels there and receive that information. Again, Thank you all for tuning in tonight and listening. Thank you to our fabulous speaker there, Dr. Essence Johnson, for sharing with us tonight so many great things as we talk about disparities in healthcare, how to be a better advocate for our patients, and how our patients can be a better advocate for themselves there. So I hope that you guys were able to gain something from this show tonight. We want to again thank the National Vision for all of their kindness and their donations, their grants that they've given to help us continue to do great things in different communities, making an impact in the optometry world. Thank Dr. Reynolds for her connections that she's been able to help us with as the National Optometric Foundation. Thank our great president, Dr. Whitehead, for all that he continued to do for the NOF, and also behind the scenes, my dear friend, Mr. Jason Mahoney, who's always working with the NOF in various ways, also helping us with our new website. Guys, go check us out on the nationaloptometricfoundation.com website. We are also on Facebook, National Optometric Foundation. Want you to go ahead and like our page, share it with your family and friends so that they can stay connected with us as we continue to share and make an impact in the optometry world in various communities. We also have a YouTube channel that you can follow us on as well there. And if you would like to donate tonight, you can go ahead and pull out your Cash App, folks. We got a Cash App, $ Protecting the Vision. We would love to take your donation. I would love to see someone donate $50 tonight. If someone donates $50 tonight, I'll match it. So go ahead, guys, put in the comments, I donated $50 so that I can go ahead and match your donation tonight to the National Optometric Foundation. We do appreciate you. And if you would like to be a part of the National Optometric Foundation, send us a message. We welcome new members to the National Optometric Foundation. You can be a friend of the National Optometric Foundation so we can continue to mentor young minds. They're helping to support those who want to be optometrists in the future, those who are thinking about going to optometry school, those who are currently in optometry school, our optometrists there as well, advocating and advancing the visual health of minority communities. We are a nonprofit organization, the financial arm of the National Optometric Association. And to those of you who may be listening, the National Optometric Association will have their convention in 2023 in Fort Lauderdale. That's on July the 6th through the 9th, Thursday through Sunday. Go ahead, mark your calendar so that you can be there at Weston, Fort Lauderdale, so that you can be at the National Optometric Association convention in 2023. All right. Thank you guys again for being a part of the show. Thank you for all of your support. Thank you to our great sponsors and our donors there. And we will continue to see you on these monthly shows. And we'll be back in November and we'll do another live show for you. Have a great night and we'll see you again.